Bismillahirrahmanirrahim. Once again, welcome to my new lecture about anti-diabetic drugs. So what are anti-diabetic drugs? Before studying anti-diabetic drugs, you should know about the pathophysiology and physiology about the diabetes mellitus. So you can see here the drugs affecting the endocrine system, steroid and anti-diabetic drugs. It has been classified into different categories like anti-diabetic drugs, corticosteroid, thyroid and anti-thyroid, hypothalamus and pituitary drugs. Today the topic which I am going to deliver that is the types of anti-diabetic drugs which is being classified into 6 categories. It is very easy to understand. Now let's see here. The first one is B1ites. So B1ites is the major class. B1ite include metformins, which is oral hypoglycemic agent. The second one is sulfonylurea. So sulfonylurias include glimepirides. While the third one is meglitinides. So meglitinides include repiglanides. You can see here. So the fourth one is thiazolic dinodiones. That is called thioglycosazoles. Another one is dipeptidides, peptidase 4 inhibitor, and with the drug names sitagliptins. The sixth one is A-glucosidase inhibitor, for example, A-cargos. As we know that, in my first lectures, if you remember, we have already discussed about the different antibiotic classification like beta-lactam antibiotics, fluoroquinolones, and many and more drugs we have written. So the same cases here like that, like this. So this is, you can see here, metformin, glimepirides and many more. So all these are the drugs which are prescribed by the medical practitioners especially. So according to the condition of the patient, we will adjust the drugs, the treatment protocol. Review the disease process of diabetes. So as we know that diabetes mellitus, it is one of the metabolic disorders. Whenever your pancreas fails to produce insulin, so the level of sugar becomes high, and that conditions is called diabetes mellitus. So what actually happens in the diabetes mellitus? First of all, you will have to treat the pancreas. As we know about the endocrinology of the pancreas. So pancreas has different type of cells like alpha, beta and gamma cells. So the alpha cells, they are responsible for the production of glucagons, and glucagon can increase the concentration of glucose in the blood. While the insulin, so this is the hormone which is released by the beta cells of the pancreas in order to decrease the concentration of glucose in the blood, while the third one is somatostatin. So I mean, if your concept is totally clear about the diabetes mellitus and its pathophysiology and its complications and many more, so then it will be easy for you to choose a suitable candidate, a suitable drug for that disease. Now, what is the role of insulin in diabetes mellitus? So insulin can directly help to control the blood glucose level by signaling to the liver, muscles and as well as fat cells to take glucose from the blood, because we are going to reduce the concentration of glucose in the blood. In normal persons, let's say a normal person, the concentration of glucose in the blood is 170 to 110 gram per deciliters. One is ABS and the second one is RBS, random blood sugar, and the second one is ABS, fast blood sugar. So you can study all these parameters, especially in lab while. Now let's come toward B1ite or metformin. So metformin, you know, metformin, so first of all, I'm going to classify it, so we should know about the pharmacological action of biguanides. The second one is clinical uses, side effects, adverse drug reactions. So biguanides are actually, biguanide pharmacologically, biguanide is oral hypoglycemic agent, or oral hypoglycemic drug. And this drug, actually, this drug is responsible to reduce or decrease the hepatic glucose productions. As we know that the liver is the major organ which is responsible for the metabolisms of various drugs. And this point is clear that all the glucose is stored in the liver and the form of glycogens. So whenever the concentration of that glucose and the blood become elevated, so this metformin is one of the effective agents against such type of complications like this which I have mentioned, like CHF, congestive heart failures. So that is the third mechanism is of metformins or biguanides, so they can directly decreasing the intestinal absorption from glucose, because the glucose, they are distributed throughout your body tissue. So here this metformin is also responsible to decrease or mimic, you can say, the intestinal absorption of glucose. So how the intestines, how the glucose, they are absorbed from the intestine. So this is very easy to understand. In order to clear the basic, the pharmacological actions or mode of action of these drugs. So as well as we can say that metformin is also responsible to improve the sensitivity of insulin. So it will compel the insulin which is secreted by the beta cells of pancreas in order to mimic, in order to reduce the content, the glucose concentration in the blood. So especially why these agents are used. These agents are used for the purpose of to stop or reduce the concentration of glucose in the blood, as well as this metformin is also responsible by increasing the peripheral glucose uptake and then utilize it. So how to receive, how to snatch glucose from the blood of the diabetic patients is, I have already mentioned, one is type 1 diabetes mellitus and type 2, one is insulin dependent and the second one is non-insulin diabetes mellitus. So these are some clinical conditions. Now at which conditions these are used. So you can see here the clinical indications. So clinically this metformin is used as the treatment of hyperglycemia whenever the glucose level exceeded the normal, which I have mentioned, the it shouldn't be above that range. Metformin is very effective in type 2 diabetes mellitus. A patient who is suffering from type 2 diabetes mellitus will be treated. The third one is nerve problem. In case of nerve problems and loss of limbs, and while in some cases a patient or a person having sexual functional problems, so you can use it because there are multiple indications. You can use a drug for multiple conditions. The drug is contraindicated, especially these drugs cannot use like in CHF, congestive heart failure, or chronic heart failure, if a patient having heart problem, so you can't use this strictly, this is strongly prohibited. So you can't use it. The second one is metabolic acidosis. In case of metabolic acidosis, so this metformin it cannot be recommended to the patient. While in case of diabetic ketoacidosis, in case of diabetes, if a patient having diabetes as well as ketoacidosis like condition, so especially whenever the concentration of ketone bodies they are high in the blood of the patient, so you can they are contraindicated. So in case of renal failures, let's suppose if your kidneys become failed, so you are unable to means there is a compensatory relationship between kidney, heart and brain. So in case of creatinine, you know creatinine. So in case of, let's suppose if there is abnormal creatinine clearance. In case of abnormal creatinine clearance, so creatinine is actually produced by the metabolism of carbohydrate. So you will have to reduce the intake of glucose. And actually, whenever the metabolisms of the glucose become fast, so the creatinine level become high. So in case of abnormal creatinines, so this drugs cannot be given to the patient. Why a patient who is suffering from myocardial infarction and there is death occurring in the segment of the myocardial muscles. So in that condition, you can't use it. Now come toward the side effects which are reported by the different literatures. So the side effect they are reported, for example, if the glucose concentration in the blood become reduced, there may be chances of physical weakness. So physical weakness, these are the rare side effects. If you remember, I have already differentiated between side effect and adverse effects, which is always occur due to overdosing. And this is actually the non-effect which is produced by the drug. For example, side effect in the form of diarrhea, like flatulency, as well as there may be chances of upper respiratory tract infections, and there may be chances of low vitamin B complexity. So actually, this was all about the anti-diabetic agents, especially biguanides and metformin. So this is very easy to understand. So actually, if you can do or attempt your paper and this pattern, so I'm sure you got this thing. Okay, thank you so much. This was my lecture about the anti-diabetic drugs. Inshallah, in my next lecture, I will discuss about the corticosteroids, thyroid and anti-thyroid drugs, and as well as the second class is called sulfonylurea, and sulfonylurea include glimepirides. So, thank you so much for watching this lecture.